We begin our 5th year on the air with a story of the impossible. Doctors have long believed that the nervous system was unable to recover from serious injuries. But now a new machine is helping prove them wrong.
When Crew Chief Mark Lally's helicopter went down during a training mission in Italy, he was injured so seriously that at first his mother Ann feared that he would not survive.
He suffered a fractured skull, facial breaks, 2 broken scapula. He had a double pneumothorax, which is 2 collapsed lungs, broken ribs, 8 broken vertebrae, shattered pelvis, and a severe brain injury.
After his initial recovery, Lally came to the VA Polytrauma Center in Tampa, Florida for rehabilitation. It was here that he met Dr. Stephen Scott, an expert in traumatic brain injury.
I want to see how strong you are today. Sounds good. People tell me you're doing good, but I got to see it myself to believe it, all right? When I first met Mark, our first goal was just to get him sitting. We never had a thought that he was going to be able to have the ability to walk. He's gone way beyond our expectations.
As Lally's recovery progressed, Dr. Scott decided to try something new. He signed the sergeant up for therapy on the Lokomat, a device that simulates walking.
The Lokomat is a gait training machine. It's part of an overall program of getting people who can't walk to walk.
What about now, Mark?
Until recently, doctors thought it impossible for the adult nervous system to recover from serious injury. But new studies have proven them wrong.
The ability to relearn to walk with a brain injury is no different than learning to write with your opposite hand or learning to play the piano when you never played it before. You're basically relearning motor skills.
And hopefully the movements will become more normal and more normalized. The Lokomat allows the body to experience that, to regenerate those neural pathways back to the brain.
Physical therapist Karen Noblet runs the Lokomat.
How's it feel?
The machine uses robotics built into an exoskeleton to manipulate the body in repetitive motions. It's simply a case of practice makes perfect. Gradually, Lally's brain should recall how to control his body.
Going down.
As he gets stronger, Noblet decreases the assistance that robotics provide.
Do we want to go active? Ready?
Now, Lally must use his own muscles to do some of the work. At first, it's a low-G workout, similar to moonwalking.
Once you have the patient in the hardware and we don't like the way their walking looks, we can then change all the angles of their joints through software.
Oh, that looks he's looking a lot better over here.
As he walks, Lally can watch his progress. One line measures the Lokomat's efforts, and the other, what his own muscles are doing.
Up at the hip, Mark.
I absolutely believe in this therapy.
Right knee. There you Keep that up.
It allows the patient to have extended cardiovascular work, 20, 30, 40-minute sessions uninterrupted.
This is in a new era of not just restorative rehabilitation, but regeneration rehabilitation, which is going to be the rehabilitation of the future. Now bring both hands down.
And for Mark Lally, every Lokomat session brings him closer to realizing that future.
He's actually, I think, a miracle. It's amazing to me that in such a short time he could progress so fast and so quickly.
Okay, Mark, we're going to sit you up here, and each and every day we're seeing improvement of his motion, improvement of his strength, improvement of his balance, his ability to coordinate, and more importantly for all of us, his ability to walk.
Nice and slow.
He constantly progresses. To watch him learn how to walk the second time is even more incredible than the first time. It leaves you breathless sometimes.
The results of this new therapy tool are proving so positive that other medical centers throughout the country are now adopting its use, bringing hope to more veterans in need.